There are many layers to our healthcare system. There are family doctors who see us, there are ER teams who care for us when we're in trouble, and there are also pharmacists who ensure we get the medication we need and that drugs are administered safely and appropriately. Right now, the province of Manitoba is on a recruitment drive, hoping to draw international pharmacists, including from the United States. There are many great jobs available in pharmacy right now, and joining us to tell us more is the Executive Director of the Provincial Pharmacy Shared Services, Jane Lamont. Good morning, Jane.
Good morning.
Thank you so much for joining us. Now, in December, the province launched this international campaign trying to recruit pharmacists, even those trained in the U.S. Why is there a need right now?
Pharmacy has been dealing with a shortage for some time now, and there's an ongoing need for pharmacists, especially when we get into areas outside of Winnipeg, into rural Manitoba. It's really important that we're able to recruit and hire pharmacists to work across our province. There's many practices that they work in. Most familiar to most are in community pharmacies, but we also need pharmacists to support our hospital systems. We have pharmacists in doctors' offices, we have pharmacists for our personal care homes, and we have actually pharmacists who work in our government structures and in research in our universities.
That's really cool. So there's a lot of different options for employment if that is something you're interested in, which we'll get to in a second. But let's talk about the job itself, because some people might think it's just that community pharmacist, they're counting pills, they're making sure you get the right dose and all of that, which is a big part of that job. Yeah. But there's so many other layers to being a pharmacist. Tell us about that.
Correct. Yeah. Some people actually call a pharmacist, especially in a community pharmacy, one of the most accessible healthcare providers. They're able to be consulted without appointments, and they often get questions about their medications and about their medical conditions. Some of the other areas, pharmacists are key. They're the key member of the healthcare team. They're responsible for the medication therapy, making sure it's safe, making sure it's appropriate, making sure it's effective. And they play some other roles, giving injections. They play a key role in our vaccination programs across the province, compounding when we need specialty kind of medications, when traditional ones aren't working or aren't appropriate for patients. As well as they have the ability to do some prescribing for minor ailments, such as urinary tract infections, smoking cessations, and there's actually other pharmacists who work with extended practice licenses in specialty areas, and they're able to prescribe and order tests and follow patients. So they're really a key member of the healthcare team. They're the experts, and they provide education for both their healthcare team around medications as well as for patients. And ironically for disease prevention as well, which with the goal of not having to take medications.
Okay, so let's talk about the jobs then. There are many different opportunities. You just named many of them. What does it take to become a pharmacist right now?
Yeah, a pharmacist, you would start off in a university in an undergrad situation, and then there is an application process to a pharmacy program. There are 9 across the country, and in Manitoba, it's at the University of Manitoba. Okay. And then you continue on with your education to receive a Doctor of Pharmacy.
Okay, so if someone wants to apply for a job or they're looking at taking the training, what should they do?
Yeah, I think the best way would to be just to reach out to our Health Careers Manitoba website, and within there's healthcare recruitment and retention, and they can line up with a recruiter and find out some information about what the next steps are.